imagining things, it's really that close. We're a community health center that serves upwards of 14,000 patient visits a year. We have many, many kids with asthma. We have many, many adults with lung and cardiovascular diseases. We are next to a grocery store that serves the neighborhood, Dave's, really important site. We are across the parking lot from a daycare center and a small community garden. That's just in our little area near the incinerator, and you multiply that many, many times over for this west side of Cleveland with its community gardens and its schools and its food handling sites. And this is where the incinerator is sited. Not to mention Brooklyn, which it really adjoins, and other dense population areas not in the city itself. This is an incinerator. They may call it a trash to gas or gasification plant. It burns things. It's an incinerator. It will produce emissions. That's what they do. I was interested to hear the head of Cleveland Public Power, Ivan Henderson, on Channel 3 saying, well, it's not going to produce black or gray or white smoke. Well, hooray. It isn't the smoke that we can see that's the problem. It's what we can't see that's the problem. It's the small particulates and soot that get deep into our lungs and cause chronic inflammation, irritation, scarring over time. That's what we're worried about. Aesthetically, no, I don't like to see smoke. But what I really don't like is what gets in deep into our lungs. So soot is a big problem. It will make lots of soot. It will be one of the largest soot emitters, certainly in Cleveland, and it's right up there for the rest of the county. The other is the heavy metals, lead and mercury in particular. Stu can give me the figures, but it will be the largest, I think, emitter of lead in the city, and it will certainly be the largest emitter of mercury, 260 pounds a year. This is what is on their permit application. We're not making these figures up. Mercury is a neurotoxin. It is hazardous to reproducing life, so babies unborn and born. It gets into the bones. It does not, it's a metal. Its half-life is 120 years or something. So over time, it can lead to chronic kidney disease, hypertension. This is just in small chronic doses. I'm not talking about major lead poisoning. Mercury is also a developmental toxin, reproductive hazard, crosses the brain barrier, can lead to neurodegenerative diseases. It isn't a good thing to have in the air. I know I already live in a community that is unduly burdened by air pollution, unduly burdened by cardiovascular and pulmonary diseases. I was struck by, when I was looking at the research, one of the things that talked about is that we know that in cities that have air pollution problems, on days that they have particularly high air pollution problems, there are more admissions to the hospital and actually more deaths from cardiovascular and pulmonary problems. People die when there's lots of pollution. And I was thinking about my patients, and one of them was nice enough to come here and join us tonight. This is Judith Young and her husband, Philip. Excuse me a second. I need my props.